Morning. My name's James Danger. I'm an embryologist, more than 50 years experience, and I'm producing these YouTube videos in order to provide a bridge between clients coming through to IVF seeking information and the data being published and presented to IVF clinic staff on a daily basis. These in-press videos look at what's been published recently, and we're looking for the 18th of July. And for this video, I'm going to look at three articles. The first one is in Human Reproduction, looking at the effects of AI, what they call foundation models, and the effects in IVF. Second one is a journal from Assisted Reproductive Genetics, looking at the nucleolus precursor bodies in zygotes. This is mainly for embryologists. And the third one is from Fertility and Sterility, a fantastic article on oocyte donation's response to donation. Okay, so just quickly, the first article I wish to briefly mention is one called Foundation Models, the Next Level of AI in ART. It's from some Norwegian authors and is open access, so anyone can read it. And the HTML address is hidden down below in the bottom here. But basically, I'll say from the outset, this is right over my head. I know almost nothing about artificial intelligence in terms of IVF, except to say that in the last year, a huge amount of effort has been put into using AI to address systemic issues in IVF to do with competency and skills. So you could start off by saying AI in IVF has traditionally been employed in very narrow, task-specific procedures such as embryo selection and semen analysis. Although effective, although I have to say all the publications that have compared AI-generated embryo selection to manual selection have not shown that they are in any way superior to the selecting skills of a trained embryologist. So from this particular point of view, the AI, even though it's able to produce similar outcomes, has by and largely not demonstrated it's more efficient at picking out the embryos that are going to give rise to pregnancy than a skilled embryologist. But notwithstanding that, although they have created a AI background to be at least as good as embryologists, these systems depend on extensive manual annotation and address isolated tasks rather than integrating the diverse data generated in clinical practice, which is far more than embryo selection. It's got to do with patient history, ultrasound, gynecology, social issues, counselling, far more things than just basically embryo selection. However, recently, what they call foundation models, looking at pre-trained on vast heterogeneous data sets via self-supervising learning modules, has emerged as a promising tool for robust multimodal analysis and decision support. Sometimes it's hard to believe people can write such complicated text. Now, I have no intention of describing any of the work. It's really quite complicated, and viewers should maybe go to that article and read it themselves. However, the conclusion is these foundation models represent a paradigm shift in AI, going from individual specific tasks like embryo selection to offering the potential to transform IVF and ART through a comprehensive, integrative analysis of heterogeneous data, that is, everything to do with people and their quest for parenthood, not just embryo. From improving embryo selection and sperm diagnosis to enabling personalised treatment protocols, these models promise to enhance clinical outcomes in reproductive medicine. So that's a sweeping statement and is really a harbinger of what will be in the future. I just wanted to make one further comment. This is a diagram taken from the paper, basically showing the information flowing through the system of monitoring the follicle development, collecting the eggs, making the embryos, deciding which one to transfer, which one to freeze, which one, and then doing a pregnancy test, and then the management of pregnancy and afterwards. And currently the AI is looking at embryo selection and also the selection of sperm. That's all. But there have been a couple that have looked at their globalized one. And basically, when they've looked at all the information available, they concluded that female age, embryo quality, and the quality of the sperm, that is male health, right, were the leading indicators for success. But the AI, the foundation model, is really, it's kind of scary in a way, because it looks for all the information. These are just, like the images and videos from the collection, conversations, other biomedical data collecting models that may try and anticipate it and then produce answers to questions, capturing images, image recognition, documentation, etc., etc. So basically, as a person that started off before Louise Brown was born, has been involved in IVF since its very inception. In one hand, I think this is exciting and new, and secondly, I also think it's slight overkill. So my summary of it is this: the Foundation IVF seeks to use all the data for a treatment cycle to provide a better clinical management advice to IVF clinics. But there's a lot of data, and one imagines how much CO2 is being produced, how much electricity is being used to generate this data, and what is the value. But I ask the question, really, IVF is a very simple procedure. That is, take a cycle. Hold on, excuse me. Sorry. Okay. Basically, IVF is a simple procedure. Take a menstrual cycle, add some drugs to collect a few more eggs, collect those eggs just prior to ovulation, add sperm, make embryos, pick out the best, put it back and freeze it, and wait and see what happens. So essentially, it's a very uncomplicated procedure, even though it's expensive and traumatic. I understand that. But will the AI produce a better outcomes, or is this really just an overkill for what in many ways is a simple medical procedure? And I would answer that in fact it's both. That the AI to date has not demonstrated that they are producing any more pregnancies per treatment cycle than currently available. However, moving forward, IVF in the future will become far more complicated and more pressure. I've mentioned a thing here called such as polygenic IVF. That is where you're taking an embryo and looking at its DNA and trying to anticipate genetic risks such as diabetes or Alzheimer's and making embryo selections based on that, in which case you'll be treating people who are not infertile but wishing to have different embryo selection tools available to them. So it could become quite enormous. And also there's a continuing trend of delaying parenthood, and with the increased mix of gamete donation, embryo selection, etc., maybe using Foundation AI may become a viable option specific to reduce the costs and the time to pregnancy for IVF clinics. So whilst recognising this as a complex service and may well be an overkill at the moment, 20 years down the track, it may be quite important. The second article I'd like to look at, this is mainly for embryologists, and this is an article to do with looking at the movement of nucleolar bodies in the pronuclei of day one embryos. So for IVF clients, when an embryologist looks at an embryo on day one to see if the fertilization has occurred, it is basically looking for two little circles inside the oocyte. So this is the oocyte, inside a coating called the zona pellucida, and the two circles represent the chromosomes from the egg and the sperm, which prior to mixing condense and undergo some checks and repair mechanisms. And when it's all finished, the two circles attach themselves very tightly together like this. And the nucleolar bodies, which you can see there's two little blebs inside, are drawn very closely to this equatorial plane. And then in a very rapid moment, these pronuclei dissolve and the chromosomes are mixed around about 20 hours after insemination, and the new genetic embryo is formed. And the authors from Japan in this closed access article, so you need a subscription to read it, basically looked at the rate at which these bodies appear. You see there's lots of tiny bodies up here, and bit by bit they get bigger and coalesce, and then round about 15 to 18 hours after insemination, they're drawn to this equatorial plane. And the rate at which the movement of these nuclear bodies occurs, these authors have suggested is an indication of the likelihood of a successful pregnancy. So we don't need to worry too much. They're developing computer models, looking at time-lapse imagery. But more importantly, they're showing that where there is a very rapid development and movement of nucleated bodies, those embryos are more likely to produce a pregnancy than where there is a delay in the formation. Now, normally the delay in formation is because prior to mixing, the oocyte checks to make sure the chromosomes are correct. And if there is DNA damage, there is quite a lot of time spent in repairing the DNA at this particular time. Well, there may well be structural issues of the oocyte, but anything which impedes the rate at which it forms is a negative outcome, has a negative outcome for the oocyte. So the authors are suggesting that on day one, with the complex AI models for looking at the rate at which these nucleated bodies form, may give you some idea of which embryos are more likely to give a pregnancy. So early on day one, going forward, using artificial intelligence, they may be able to give clients an indication that we've collected 10 eggs, we've made 8 embryos, of which 3 we think have the likelihood of forming a baby. So having a bit of warning allows people to make decisions about embryo management, and this is why this paper was selected. The third one has to do with oocyte donors. Excuse me. I apologise for that. So this study is an open access one from some authors in the United States. And if you're interested in oocyte donation as a donor or as a recipient, this is a really good article to read about the experience of oocyte donors. It's published in Fertility and Sterility, and this is the hyperlink where you can go back and read the paper. So just very quickly, the authors were interested in the post-donation outcome from oocyte donors, and basically they looked at 363 participants aged 22 to 71. 22 is pretty young, from a donor registry or Facebook groups who had donated on the average 3.3 times, 3/4 of which were anonymous donation, nearly all were Caucasian, and half were married. That is, one assumes, already had children, and so their donation was post their own family arrangements. The average length of time from the initial donation study was 13 years, so that's a fair amount of time to look at the post-donation outcomes. So you can read the paper, but just very briefly, nearly all the participants felt that their oocyte donation experience was very positive, but nearly all reported pain, including ovarian hyperstimulation pain, changes in their menstrual cycle, and some emotional distress. But the distress was quite low compared to what most people felt was a positive experience. Now, I'm not experienced in counselling depression, but basically the authors were reporting the most common forms of stress were anxiety and depression, and basically the rates of depression were probably higher than the national average. That is, that there is some downside to being an oocyte donor in wondering what happens. Annoyance, guilt, eye opener, adaptation to include drugs was associated with depression, indicating the importance of screening oocyte donors for mental health and drug and alcohol misuse before and after donation. And I thought this was a really interesting observation. There were concerns, including lack of communication after the procedure. That is, the clinic collected the eggs and said, "Thank you very much, goodbye." But there was very little information provided on the long-term health outcomes, particularly of the children that were conceived and the outcome of their donation. The clinician may like to incorporate these findings when counselling populations in the future. So that is my summary for this section. I'll leave you and wish you all the best. Okay, thank you.